Hello everyone, my name is Dr. Durgesh Srivastav and I'm a consultant rheumatologist practicing in Lucknow. Today I'm here to discuss some basic information about arthritis and rheumatology in India. As we all know, arthritis is a very common condition, and as per the rough estimates which are available with us, it is said that around 15 to 20% of the general population, they suffer from symptoms related to arthritis at least once in their lifetimes. So it is very important. Another thing is that arthritis is not a disease by itself. It is just a symptom of any underlying conditions. As per WHO, there are more than 100 of diseases which can cause symptoms of arthritis. So first thing first, what is arthritis? Any pain or uneasiness in joints is caused maybe due to arthritis. So to qualify as arthritis, the joint must have swelling and pain, or any of them. So why it is important now to diagnose arthritis correctly? It is because if the treatment and the diagnosis are delayed, arthritis can become aggressive and it may cause permanent damage in the joints, so that the joint may need replacement later on, which may be very costly and may not be affordable for many of the patients. So next thing is that when should you think of consulting a rheumatologist for your problems? I mean, when should a person think that he may have arthritis? It's a very important question, because if people are aware of this, they may go to the consultants early and the disease will be diagnosed early, so that the complications may be minimized. So I'm going to tell you when should you suspect arthritis. The first thing is early morning stiffness, which is the earliest of the symptoms in most of the patients. So early morning stiffness is perceived as difficulty in doing your movements first thing in the morning, like getting up from the bed, having uneasiness and stiffness in your back, difficulty in flexing your fingers in the morning, having tight fingers in the morning. So that is a very important symptom of arthritis. Second thing is having pain or stiffness after doing rest in the daytime or after sitting for some time. That is another indicator for getting evaluated for an underlying condition causing arthritis. Similarly, back pain, which is relieved by walking or relieved by exercise, is a very important indicator for arthritis. Arthritis is just like I said, of many types. So basically, diseases causing arthritis are many. Some of these may be non-inflammatory arthritis, which is like degenerative conditions related to wear and tear due to age and excessive work. And out of these, the most common one is osteoarthritis, which is commonly seen in elderly people. Elderly meaning more than 60, but in India, osteoarthritis is commonly seen in people even up to 40 years of age. So in India, arthritis is seen in early age also. So the next type of arthritis, which is inflammatory arthritis, is the more important one, because that is the one which is associated with other systemic features also. Systemic features may be fever, problems related to lungs like interstitial lung disease, problems related to heart, kidneys. So this is why it is very important to diagnose inflammatory arthritis and the underlying condition which is causing the arthritis, because the the internal organs involvement is not easily perceived by the patient, and these things uh, become obvious only when the damage is advanced. So now, after knowing this, the persons should try to contact and have a consultation with the rheumatologist as soon as they think they are having any of these symptoms. So by consulting early, we can minimize the cost of the treatment, we can minimize the chances of permanent damage, and we can maximize the chances of long-term remission of the disease, because inflammatory arthritis is known for its flares. It can go into remission and it can come all of a sudden with any bout of infection or some diarrhea like urinary tract infection or respiratory infections. Many infections can trigger a flare of arthritis. Some of these arthritis may be having inheritary component also, and few examples of these are rheumatoid arthritis, ankylosing spondylitis, and sometimes gout, which is due to excessive uric acid. Remember, uric acid is just a factor in only one type of arthritis. It is not at all related to any other arthritis other than gout. So it is another misconception among the common public that arthritis is because of uric acid increase. So if you have seen this video, you should tell people that think about these symptoms whenever you think they are there, and try to consult a rheumatologist at as early as possible. Hope it was helpful. Thank you so much.